So once our patient fully understands how to properly contract the multifidus, then we can actually progress her to stage 1 with lower extremity movement. So Alana, let's guide you through the first stage of initiating the pelvic tilt contraction, firing the multifidi, good, and arch a little bit, good, relaxing the thoracic motion, and pelvic tilt, good. So we're swelling up the lumbar spine, we're drawing in the lower abdominal musculature, good. So we want to make sure she keeps her body weight nice and centered, so she's not rocking backward, we're not coming up into hip flexion, we want to keep her arms at 90 degrees, okay? So with the multifidi contracted, with the transverse abdominis contracted, Alana, what I'm going to have you do is gently telescope up your knee off the plinth. So just gently lift, okay? We're going to hold that for about 2 to 3 seconds, and then alternate to the opposite side. Okay, you can do that for me, making sure that she keeps that posterior pelvic tilt, keeps the abdomen drawn in. We also are looking for pelvic rotation. We want to make sure that her low back is flat, as if we have a ruler on there, that it wouldn't tilt either medial or laterally. Okay. The other thing we always want to cue for is that she keeps her body weight forward. So sometimes you can even put your hand on her sacrum here, give her a little nudge forward, okay, making sure she keeps that pelvic tilt, keeps her weight forward, and hold, good, and hold, good, and relax. And you can also palpate her TA, make sure they're firing, and palpate the lumbar facets on both sides to make sure she's staying in that posterior pelvic tilt in that swelled position. Good, and relax. And that's the initial progression for the multifidi exercise.